So just got a question, and I've heard this question a lot and wanted to record this for you, but can knee pain cause back pain? It's again, very common question. We see a lot of people here in physical therapy who are having knee trouble and then they start to develop back trouble. So it might be after a total knee replacement or a knee surgery or something like that, then they develop back trouble. Oddly enough, the research says exactly the opposite. And I know what you're thinking right away. You're probably saying, yeah, but I had my knee pain first. That caused my back problem. Well, again, research says usually the opposite is true. And here's what happens. So we're thinking that a knee problem can cause hip pain or a knee problem can cause back pain because it might change the way that we're walking. What research says, and just from studying a lot of people, and I find this to be very true in the clinic, is usually there's an underlying problem in the low back or pelvis. So just for a reference point here, this is like looking at the pelvis right here. This is the tailbone. This is the right hip, left hip. This would be the knee down here. The right knee and then the left knee. So really what's going on is usually there's a problem in the low back or like in the pelvis, like in the SI joint, like right here. And then that will cause either a hip problem or a problem in the knee. And really, really dramatic success that we've seen. So when we see somebody with knee pain, we always screen out up above and down below. So we'll take a look at their foot, their ankle, their hip, and also their low back. We've had people with low back, with knee issues, and I'll give you one specific example that I remember. We were seeing a lady, she was 3 weeks into PT, she was doing classic knee therapy, exercises, I was doing hands-on therapy for her knee, and we got to the end of 3 weeks and she just said, she was like really depressed, and she said, you know, it's not working at all. And I said, okay, do you mind if I just like take another look again at your back? And she said, yeah, but I'm not really having trouble with my back now. And I said, well, have you ever had pain with your back? And she said, yeah, like my entire life. It just kind of comes and goes as it pleases. And I said, okay. So we went through some testing. I found like one really small problem right here in her. It's called the SI joint. In central Pennsylvania, a lot of people will call this their sciatic, but it's actually the small joint between the tailbone and the pelvis. And I did one maneuver, one hands-on maneuver, no cracking, popping, anything like that, and she went from being able to kick out, so this is where she's sitting, kicking her leg out, 37 pounds. It was 37 pounds on day one, and it was 37 pounds on her 9th treatment in the 3rd week. We did that one maneuver. It took less than 5 minutes to do, and she immediately went up to 54 pounds. So, and like it was less than 5 minutes. So really, really quick and easy. And you know, without a doubt, in her case, it was that underlying back issue that was causing her knee problems. Within 2 more visits, she was 100% better, was able to get back to running. I think she did like advanced yoga, if I remember correctly, and also did a lot of gardening, was able to get back to all that. Her strength was normal, her range was normal, everything else. And this is somebody who was like trying to avoid a knee surgery, a total knee replacement. So had horrible looking x-rays on her knee, but had this underlying back problem. And what that really did was open my eyes up and start to look for that. Again, it's in the research. The research studies that look at literally thousands of people say that many times there's an underlying back or pelvic problem that causes problems in the hip. So like people on the that are about to get a total hip replacement or a total knee replacement or a surgery on one of those areas, many times they have that underlying back problem. A good physical therapist can help you with that. Hopefully this helped you out. Leave me a comment below and hit the thumbs up, thumbs down, subscribe to the channel, and I'll talk